South Korea currently has the second highest number of confirmed COVID-19 cases, and many of them can be traced back to one church in Daegu. The church is known as the Shincheonji Church of Jesus, Temple of the Tabernacle of the Testimony. But what's really worrying is that most of the cases from the church originated from one single lady, most commonly known as Patient 31. The 61-year-old woman tested positive on February 18, and on that day, South Korea only had 31 cases. The next day, it increased to 51. As of February 28, there are 2,022 cases, of which 1,314 were reported in Daegu. Just how did one single woman turn into a super spreader that possibly infected hundreds of people? Patient 31 was first warded at a hospital in Daegu for a car accident on February 7th. The next day, she developed a sore throat. On February 9th, she left the hospital to attend a service at the Shincheonji church, which lasted for 2 hours. She developed a fever the next day. On February 15th, medical staff at the hospital told her to get a screening for the virus, but she refused on the grounds that she had no recent travel history to mainland China. She then left to meet a friend at a hotel buffet restaurant. The next day, she attended yet another service at the church. She finally agreed to get tested for the COVID-19 virus on February 17. She tested positive the next day. But to really understand how Patient 31 turned into a super spreader, we need to look at the Shincheonji Church and their practices. The Shincheonji Church was founded in 1984 by controversial religious leader Lee Man-hee and has over 200,000 followers in South Korea, with over 9,000 in Daegu. The church has claimed that the founder will himself take 144,000 people with him to heaven on Judgment Day, among other things. Services at the church would usually last 2 hours, where members are required to kneel on floor cushions placed so closely that their shoulders would touch. What's more, members were told to remove any objects from their face while singing loudly, including masks or spectacles. It was also common to share food between members after service. A key belief is how members viewed illnesses. Followers were commonly told not to care about worldly things like jobs, ambitions, and even illnesses. To the followers, getting sick is seen as a sin, for it prevents them from doing God's work. The church's founder Lee Man-hee has even said that the COVID-19 virus is an act of the devil that wants to destroy the advancement of the church. This could be a possible reason explaining why Patient 31 initially refused to be tested for the virus. More than 1,000 members of the church have since displayed flu-like symptoms, and the few who have tested positive for the virus have revealed themselves to be members of the church, including a senior health officer. The church in Daegu has since been shut down. The church has also agreed to cooperate with the government by providing a full list of all its members, as well as testing all of them for the COVID-19 virus. But the biggest question still remains: how did Patient 31 get infected in the first place?